Good morning and welcome to Resolutions for Recovery. The show is dedicated to the education and empowerment for all people struggling with substance use disorder. And we are going to stand in the solutions today. That's what Maureen Rossi and I are going to talk about today. And again, I'm finally, hopefully going to have surgery on my wrist. And we're going to just discuss still the barriers with insurance companies. So I have lost my proverbial mind in the last week just dealing with my own health care and not tolerating the BS that they still want to put us through. So we have rights and we have available organizations that can help fight that also, or just call me. I'll do it for sport now. So good morning, Maureen, and thank you so much. We had a little confusion yesterday. It's all good.
It's all good.
And it's so, Maureen, so Maureen Rossi is the original founder of Kings Park in the Know.
One of them.
One of them. And Kim Revere, also,
a lot of great people.
A lot of great people that created one of the first coalitions, really, to deal with drugs and alcohol in our communities, which we still need more of. And you're a freelance writer, and you're just an awesome person. And you've been doing this reporting for a long time before it even came out in the public. And really, it came out in the public, I'm going to say 2013, 2014, because I know I was one of a very big mouth that came forward and not going to stand for this anymore. But you actually started reporting in 2005.
Yes. I've been a freelance journalist, columnist for 25 years. I had a little radio show. I produced 2 documentaries. One was with Senator Flanagan about the epidemic years ago. The first time this appeared, the epidemic, not just drugs and alcohol, but the opiate epidemic, it was kind of Long Island's dirty little secret. And my first op-ed for Long Island Daily called it Long Island's dirty little secret. But my friend Tim Boldra at the Long Island Press did a cover story called Long Highland. And I believe that was in 2008. So that was kind of the impetus. I tried to galvanize all my friends in media because people couldn't care about what they don't know about.
Right.
And I first came upon this problem in 2004, and really no one knew about it. I mean, right. No one, no.
You know who knew about it? John Venza was talking about it. John Venza, who's the vice president of Outreach Adolescent Treatment Services, started talking about it in the 90s, believe it or not. He saw the trend coming.
Yeah. Well, unfortunately, a lot of people don't know this unless you're like in the inner sanctum, like us, in the movement. When pain became the 5th vital sign in 1999, and I think it was done with good intention by some veterans groups, people with chronic pain. Pain became the 5th vital sign in 1999.
But I'm going to call it what it is. It also became a big push by the lobbyists of the pharmaceutical companies because that bill was signed at the end of a bill that had nothing to do with pain as the 5th vital sign, and President Clinton signed that into effect. And it was off to the races.
Absolutely. A big pharma got right in bed. They got right on board. They're powerful. They're so well funded. They're up there with the NRA. And
they are so well funded. And you know what? Go look into your congressmen on a federal level and your senators, your federal senators, and see how much money they get from the pharmaceutical companies.
We would all be remiss if we didn't do that. I mean, they're all well funded by it. But really, when you think about pain as the 5th vital sign, like its siblings, blood pressure, pulse rate, it's not quantifiable.
Right.
A happy face, smiley face, sad face. Yeah. That's not scientific. That's not quantifiable. So we have this unquantifiable data, and kudos to Suffolk County for suing Sackler and Big Pharma, the makers of
the opioids. Yeah.
But actually, Purdue. It was West Virginia.
Yeah.
Was the first municipality in 2001 that sued that Purdue Pharma, and they settled. Purdue Pharma settled. It never went to trial in 2004, and just awarded the state $10 million, which was supposed to be funneled into addiction and prevention. So Suffolk, I applaud their efforts, but it's 2019.
Right. Where
and West Virginia sued them in 2001. So, in all due respect.
In all due respect, too, so watching the news today and watching the distributors, and people may be saying, well, that's ridiculous. It's not ridiculous. Everyone along the trail from the prescriber to the distributor of the drug to your local pharmacy is culpable in this situation. When you see, and I don't have the actual number, but we'll just talk in round number.
Sure.
If there were 2,000 cases reported to the RDC up in Westchester County, 14 of them were reported to the DEA. That's not okay. When your own employees are saying something's wrong in where we're distributing these pills to.
Right. Someone dropped the ball. Bottom line, the DEA is responsible for oversight. Yes, they're charged.
But they can only investigate what is reported to them.
Right.
So the son of a gun of RDC, who was indicted and arrested, and the poor man taken away in handcuffs, when his salary went to $1.5 million a year because his opiate sales skyrocketed.
Right.
What was fueling his desire?
Oh, absolute greed.
Greed.
Yeah, just
it
like
all comes down to greed.
Greed
on everybody's level.
And he should be taken away in handcuffs because he was mandated. He's mandated by the law to report how much they prescribe.
And it's almost, I'm going to say it's equivalent to reporting child abuse.
Absolutely.
So this is abuse. You're abusing someone that could cause them death.
Unethical, immoral.
Right. So.
But a lot of bad players out there. A lot of bad players. Here we are in 2019. This really started to emerge after pain became the fifth vital sign.
That's 19 years ago. 20 years ago.
20 years ago when pain became the fifth vital sign. So we're 20 years into it, and the epidemic has morphed. It's the greatest drug epidemic in our nation's history. And it's morphed into something we could have never predicted. You remember, we all lobbied for iStop, the mandated communication system between doctors and pharmacists. Now, we thought that would be not a panacea, but we thought that would really put a screeching halt to doctor shopping. And we anticipated a slight uptick in heroin use because the pills would dry up. What we didn't predict is that soccer moms and dads would be snorting H.
Yeah.
We had a couple in our town, 2 doctors. The father died. The mother was brought back, thank God, with Narcan. The children are not left without 2 parents. And, human trafficking, body brokering. It's morphed into,
It's morphed into beyond what anybody
no one
could
have
see.
anticipated.
But there's still, if you don't use iStop, it's not effective.
Right.
So every doctor is not using iStop. Every treatment facility is not using iStop. Everybody is utilizing the very tools that they have that could show, because it's not only opiates now, it's benzodiazepine.
Benzos are huge. Yeah.
They're huge. So Valium, Xanax, all those.
Yeah. A lot of
That's
Americans
the
don't
new.
wake up. Oh my God. A lot of Americans do not wake up because they had benzos and alcohol.
Right.
A lot. There are a lot more empty chairs at family tables because of that. But who's charged with mandating this? Who's the overseer?
You know what? I don't even know anymore.
Yeah,
But it all still comes back to, with the age of onset being 10 years old for a boy, 10 years old for a little boy, and 11 and a half for a girl. If no one in this country could take a step back and say, what the hell are we doing to our kids?
Yeah.
If at 10 years old they want to step out of their bodies and their minds.
They're so uncomfortable with life.
They're so uncomfortable with life
That they need to step out.
What's our role? What's our role? But what's the doctor's role? Give them something.
Right.
Oh, they have ADD. Let's prescribe them
Right.
something. Oh, you can't sleep. Let's prescribe them something. They're 10.
I remember the very first time you and I went to the Senate. I think it was Phil Boyle ran it. And
Yes. Oh, my God.
And I remember a mom stepping up and she said she had lost her only son. She was one of our angel moms. The very first drug her son ever took was an ADHD medicine. So many of the kids have been prescribed into their addiction. And we have to look at it's a bigger picture. Our societal, we're like in a cumulative coma. We're in a societal coma when it comes to raising our children. I mean, why are kids so uncomfortable? They have no coping mechanisms.
No coping.
They're not resilient because everything's made perfect for them.
ADD, attention deficit, whether you're hyperactive or not, was around when you and I were little.
Absolutely.
it was called being rambunctious as a kid.
Yes.
You were taught how to sit still.
Right.
You learned other coping skills.
You're
not allowed to get up and run around the classroom.
Right.
That's not okay. So maybe the teacher was challenged.
Right.
But that's what they called it then, right?
Yeah, yeah,
being
just
rambunctious.
a little scoochie.
Right. And so why does all kids have to fit into, if you're a square peg, you can't fit into a round circle.
Yeah.
So why can't there be other things done for them, right?
Yeah.
Give them other jobs to do that allow them to get up and move a little bit more.
Right.
Like, I don't know, meet them where they are.
I taught religion for St. Joe's, and I had some kids in my class, and we taught confirmation class in the house. And so I would have one kid go set up the fire for when we had the second part of the class. I would invent games like Lenten Jeopardy. The kids couldn't all sit at the table and learn in the same rate. So I had one kid making snacks. I had one kid lighting a fire. You can't engage all children. One size doesn't fit all.
Or you just say to them, listen. The sooner we get through this, the sooner we can have some fun.
Right. Oh, I always say that.
there's things that you can do.
Yeah.
So I'm going to. This is just a funny story. I was thinking of it with Easter here and communion. When I taught communion for Andrew's grade, I used to make them butter, Pillsbury biscuits.
Right.
Hot, put butter on them, and they all came back from receiving their first communion making that face going, this doesn't taste like yours, Mrs.
No, it doesn't.
No, you don't just.
It doesn't.
But have fun with kids.
Have fun with kids.
They are challenging.
Yeah.
They are.
Yeah, and adolescents.
But they're not perfect.
Adolescents are why some mammals eat their young, but, hey, listen, that's the way it goes. But, here we sit in 2019, and, we've built a bridge. People in the movement, people in prevention, addiction field, they've been tremendous. We really know some extraordinary people in the treatment world, and we're building this bridge as we go along, and it's constantly ahead of us. The epidemic is constantly one step ahead of us, and we've built the bridge. Narcan.
Narcan is not prevention. It's not anything.
No.
It's one more shot at life.
Prevention. Some prevention programs in some schools, they should be mandated kindergarten through 12.
Yep.
I called for that in one of my op-eds in New York's Long Island.
So
Daily.
in Syracuse, they use. I have to remember the name of the program. So in some really challenged school districts,
Mm-hmm.
they're using this program in kindergarten, first, second, and third grade.
Probably a gang
It went
component.
from 20 kids ending up in the principal's office on a daily basis to 0 kids ending up in the principal's office.
Right.
Because what are they learning? Mindfulness, meditation, and they are rewarded for good behavior.
Yeah.
So again, what do kids always want to please, but if you never reward them for pleasing,
Right.
bad behavior is attention for bad behavior is as good as attention for good behavior.
Absolutely. And the critical component of any prevention program is evidence-based. We need evidence-based programs. And each school district will have different needs. Ones with a gang component, that's woven in, but they all kind of work on the same tenets. But here we are in 2019, and we have this great bridge that we've built on the backs of far too many people. I mean, we've lost over 7,000 people in Nassau and Suffolk alone to this epidemic. If someone came in the last 19 years and murdered 7,000 of our people in Nassau and Suffolk, we would have vigilante groups in each community, undoubtedly.
Right.
And
if
it's egregious.
some other disease came in and did that,
Right.
listen, when Zika, right? In a day, we spent over $1 million to get ready for a mosquito that never came. Really?
Yeah, that never came. Look at the measles outbreak. We galvanized, we hit that baby head on, and you know what? This is bigger than measles, actually.
It is.
And
more life-threatening than measles.
Absolutely. So we have this bridge, and there's levels of continuum care that are necessary to get someone. I mean, we have that microsecond where maybe someone suffering from addiction wants to get well. That microsecond.
And it is a microsecond.
A microsecond. And we need to get them into treatment. I remember sitting on my front porch with parents over the years trying to get them beds when they had overdosed and saying, no, you have to fail at outpatient first. before we get you inpatient.
My son.
What exactly? Thomas, what about a heroin overdose doesn't scream failure?
You know what? Last night at 11:45, I got a phone call, and a young woman overdosed, and she just turned 21 years old, has seen life far too past her 21 years of age. Her dad is a nurse. It had to do CPR along with Narcan for over 10 minutes. She was released at 4 o'clock this morning.
Oh no.
So why? I don't give a rat's patootie if she was being a difficult patient. That doesn't give you the right as healthcare professionals to release someone at 4 o'clock in the morning without a discharge plan.
Yes. Now we're just in the contingent on Long Island was just up in Albany, and although there weren't any legislative wins this year, there were a great many monetary wins this year. And two of the ones that made me probably most happy were SBIRT, screening, brief
Right.
intervention, and treatment, going to be mandated, I believe, in emergency rooms when someone comes in with an overdose.
That's been happening though for a lot of years,
Right.
and it's still not into place.
But the other one was medically assisted treatment. So, we have an angel mom friend whose daughter overdosed, was brought to an ER, was released, went home, overdosed, and died. And one thing that we're missing, we keep dropping the ball. We keep okay, we're going to have medically assisted treatment in ERs. We're having SBIRT, that's being implemented. We have PEER. We have Sherpa. But now, why aren't they mandated to keep an overdose victim a certain amount of hours? I know there are laws, but
the patient always has the final say.
Right, patient rights.
But they don't keep them. And to be quite honest with you, Thomas Hope is part of the Sherpa program. So I don't care how many times you tell me how many doctors you have wavered. If they are unwilling to write the prescription in the ED department because they're uncomfortable writing the prescription. So again, asking me as the president of Thomas Hope to write a letter of support to get more grants to waiver more doctors, and I said, well, why aren't they writing the prescriptions? We need to make them more comfortable. So my response was, do you give them more training to become more comfortable in writing amoxicillin for an ear infection?
Exactly.
Insulin for diabetes. Do doctors need their handheld for that too? Well, don't be ridiculous. Why am I being ridiculous? Right. Why am I being ridiculous?
Apples and apples.
It's apples and apples. You have an opiate problem. I'm going to give you 3 days worth of a script that's going to keep you alive so you can get to treatment on Monday, especially over a weekend.
Right. Now, listen, doctors weren't uncomfortable writing opiate scripts, but in all due respect,
No, they're not uncomfortable. And our good friend Avi Israel, his son had Crohn's disease. Right? Suffered greatly, and
Michael.
Not one of his doctors meant to cause him harm. They were trying to keep him from pain.
Suffering.
And when he was addicted to the very painkillers that his surgeon, his gastroenterologist wrote, then they all said, oh, you're addicted? We can't treat you anymore.
Right.
We're done with you.
Right. Well,
and nobody gave him the solution.
There were no,
The insurance company paid for the surgeon, for the doctors, for the drugs that got him addicted, but wouldn't pay for the treatment to get him well.
We still have gaps in parity. We really do still have gaps. But honestly, we left the other half of that bill for the biennial education of doctors on pain back in 2014 when the movement...
Well, it passed. It passed in 2016,
after.
a much watered down version.
It was much watered down, yes. But we, like any legislation, it's a chess game. We had to leave half of it when we passed ISTOP, the movement. And, people said, oh, you're never going to win with the American Medical Association. Well, you know what? We kind of did.
Yeah.
Twice, ISTOP, and then somebody's dropping the ball. It's not always being reported. And then the biennial education. But you know what? Now it seems as though doctors need biennial education about writing prescriptions for Matt. First off, the one thing that, and doing in-service education for healthcare professionals, they don't get any education on substance use disorder. Right.
They get zero. It's an elective. And if they do get any, it's 2 hours.
Yeah.
So I just was lucky enough to present to the Stony Brook School of Nursing, to a lot of nurse practitioners,
Excellent.
you know, and I'm going to work with them. They don't know what they don't know either.
Before we passed that bill in 2016, doctors in medical school had 6 hours of education on pain treatment. Veterinarians have 60. Veterinarians get 60. Doctors had 6 on pain. So yeah, there are so many gaps in services all over the place. We are far from done.
Far
And the
from
human
done.
cost is unquantifiable.
It is. It's you know, just dealing with my own, trying to get my own authorization done. And I told them, you know what? I'm being traumatized, me, because this brings me back. So unfortunately for them, I did tell them too, you just screwed with the wrong woman. Because
Amen.
if you think it's going to stop here, it's not going to stop here. Because this is complete and utter baloney.
It's unacceptable.
Because 3 things happen. They're counting on you not being there insured, therefore they won't pay the claim. You'll just go away, pay it for you out of your own pocket because they keep saying no and you won't fight it. Or you'll be dead.
Right.
I'm not going to die from my wrist. But it's still unacceptable to, you know,
You pay into your insurance.
here's your hospitalization. We're going to keep you over here, though.
Right.
We're not
Dangle the
lifting
carrot. We're going to
fence.
dangle the carrot over here. Unacceptable. We're customers. We're customers.
Customers.
We're customers. We pay into our insurance. We're customers.
Exactly right.
Yeah, the laws are insane. The healthcare system has a long way to go, but you know,
Absolutely.
absolutely, it's sad. It's really sad.
It's sad.
It's sad, particularly with the opioid epidemic.
You know, so still, you know, Thomas has gone 7 years, you know, and it just fuels my soul.
Wow, I met you
to
6
help
years ago.
The next young, you know, I just tell parents, I wish I had me to hold my hand through everything that I went through. So I'll hold your hand, and we're not going to take no for an, you know, we're not going to do that.
Right.
We're going to get you well. We'll lead you on your own road to recovery,
Right.
and maybe that will spur your loved one.
Right.
Yeah,
Yeah.
it will certainly change the dynamics at home.
Yeah, parents are not powerless. If they have a child,
They're not
a loved
powerless.
one, and we can't even say parents anymore. For the longest time, it was a youth heroin and opiate epidemic. It's no longer a youth.
And to be quite honest,
no
at
longer
Good
heroin.
Sam down in West Islip, alcohol is the number one problem that comes in, that presents at the
Absolutely.
ED department.
And crack is back, and cocaine
Crack
is back. And
and
meth
cocaine
is
is
here.
back.
Crystal meth is on Long Island. It's been here for several years, but it's being sprayed on the marijuana. It's showing up all over the place. And as we saw in reports, I think
And
it was last
fentanyl.
week, fentanyl was found in marijuana upstate by Albany. It was just a matter of time. There were some false reports around the country. This was legit. I did some background search. And, you know, dealers they're not scrupulous. They don't clean their scales before they weigh one substance and another.
Well, and but to be quite honest, if
It's
they
purposeful.
can addict you, however they need to addict you, they will.
Right.
The other thing with parents saying, oh, marijuana, it's just innocuous, it's not a
Yeah.
big deal. I can't tell you how many kids have
Psychosis.
schizophrenia, psychosis, the onset of mental illness in adolescence
It triggers it.
has skyrocketed.
It triggers it. Listen, it's
Just
not your
this
parents' pot.
morning.
It's not your parents' pot.
Vaping, you know, so Walgreens and I think Rite Aid are looking to raise the age for any tobacco products to
I saw that.
21,
I saw that.
right? But the vape pens, one hit in your vape pen is equivalent to smoking 20 cigarettes. And you think the vape pen is okay?
And the heavy metals go right to your kidneys. The heavy metals are even more
So-
dangerous. Yeah.
Because parents don't want to say no.
Right. They don't want to. They want to be their friends. They don't want to. They don't know how to say no. You know.
And let's be honest, Maureen, it's easier to say yes
Yeah.
than it is for that long, drawn out fight.
Right.
My father used to say, don't let the bastards weigh you down.
That's right. I used to say, I love your father. I never met him, but I love him. Too bad, so sad. When you start chipping in for the mortgage, you can do whatever you want. Until then, I'm the boss, applesauce. That's it.
Right.
You know, and vaping's bad news. But the pot, really, I wrote an article years ago called It's Not Your Parents' Pot.
Right.
And it's sprayed. Dr. Stephen Dewey just did another presentation,
Yeah.
but my contacts with the DEA back in 2010 were telling me that the pot on Long Island was sprayed with crystal meth back then. And the Suffolk County Police Department, I love the work. I'm the daughter, Mike Glenn was chief of police, same name as my dad, NYPD, chief of police years ago, an uncle of mine. So I have great reverence for law enforcement, extremely, supportive of them. But they were telling me that, no, it's not sprayed with meth. But the DEA said, no, we have conclusive evidence, scientific evidence it's sprayed with meth. Stephen Dewey just said it a month ago. The pot on Long Island is sprayed with meth. Crystal meth, it causes dementia, Alzheimer's. This is not your parents' pot. This is so much more dangerous. I have a friend whose child killed himself on Christmas Eve. All he did was smoke pot, 18 years old. 18 years old. So yes, pot is dangerous, and listen, I'm not a prude, but this is a whole nother level. We're dealing with a whole nother level.
If we take out shame, stigma, all of that, these are your adolescents. So would you let them play Russian roulette with a loaded gun?
Absolutely not.
So why are you allowing the use of drugs and alcohol? You can't say that that's okay.
Right, you can't.
It changed. There's, never mind that, it's just wrong. So let's take all of that out.
Illegal.
There's the science behind all of it. It changes their brain forever.
Forever. Listen.
So you question every vaccine that your kid gets.
Right.
But they can go, drink a pint of vodka on the weekends because that's okay because you did it.
Right. Or you opt out of tests because poor little Susie or poor little Johnny will be too stressed out. Well, you know what? Here's what I told parents all over Long Island. We have quantifiable data that shows us the earlier a child uses a substance, it changes their brain forever. Their brains grow and develop till they're 25. We didn't wear seat belts when we were growing up. I remember in those big old cars, they
I'm going to
cut seat
hold
belts
you
out.
there because believe it or not, we ran out of time. So we're going to pick that right up. But just remember that little thought that Maureen just shared with us, and we'll see you in a few minutes.
Few minutes?
One, two, three. Long before my dream of playing professional football became real, addiction impacted my family and nearly destroyed it. As a New Yorker, I can tell you that all our communities are being hurt by addiction. New York State is leading the fight in combating addiction, providing help and treatment regardless of your ability to pay. For more information, visit combataddiction.ny.gov. Growing up as a young kid when addiction was around was tough. It was, at the time, I felt like it was unfair. I had to grow up quick. At the age of 11, my father left the house after, a couple months after I found drug paraphernalia in their nightstand. And it was a tough reality to face as a young kid. And, there were good days and bad days, but there were a lot of bad ones. After my father left, we got kicked out of homes. There were people in and out of my house, and I didn't understand, why did this happen to me? Why did addiction why did my parents have to be addicted to drugs? Yeah, going through recovery it was a long road. When I was a senior in high school, my mother went away to prison. I had to go through my college recruiting by myself. I had to go off to college. My friends' parents took me to college. And so it was tough going through those times. But when my mom decided that she wanted to change her life, she wanted to get help. My mom got sober in prison. She got out of prison and gave up drugs and regained her relationship with God. My mother works for the church now, and we have a great relationship. I tell her every time I talk to her how proud I am of her and what she's accomplished. She's a tough woman. She's been through a lot, but the things that she's done after prison have been amazing. You know, I'm so proud of her. She got her associate's degree. We have a great relationship. She's a great grandmother to my nieces and nephews, to my children. She's always there for me when I need to talk to her, and we have a great relationship. For a while, it looked like, you know, when you're in it, when you were in the addiction part of it, I never thought my mom would be the same. But there is a light at the end of the tunnel. You can change your life, you can get help, and you can have a better life and regain those relationships and have a positive effect on those people around you. You know, I look at, you know, when I go through tough times in my life, I ask myself, what would my mom do? Because my mom has been through, you know, I always say my mom has been to hell and back, and she's doing great, and I'm thankful for it, and I'm proud of her. My father as well. You know, I didn't have the best relationship with my father. When he left the house when I was 11, he left us with no car. I didn't speak to him for 3 years, and that was probably the toughest time of my life. But we gained that relationship back. My father's been clean for 3 years. His health is doing better. He's trying to be a better grandfather, trying to be a better father. And, you know, I forgive him. And our relationship is, you know, we're back communicating, and I love it, you know. I tell him I'm proud of him as well, because it's a tough circumstance. You know, it's easy to look at someone who's in addiction and blame them, and blame them for the choices they make. But it's the drugs, it's the alcohol that have a hold of them. And it's not, they don't want to be in that position. You have to understand that. They don't want to be making these decisions. They don't want to put these people in jeopardy. They want to get help. But once they decide to get help and to do something about it, there's great things that can happen at the end. Yeah, recovery is possible, and it happens to a lot of people. You know, you'd be surprised at how many people are in recovery right now that went out and got help. People out there that want to help you if you're in recovery. You know, there are people all over who you have no idea went through, they've been affected by it. You know, whether it's a family member, a friend, themselves personally, if they went through addiction. There are a lot of people that are going through issues that you've been through. So don't be afraid to ask for help. There are a lot of resources out there that can help you and get you the right treatment and to get you back on the road to recovery.
Welcome back to Resolutions for Recovery. So we gave you a great backdrop, I think, on the epidemic and how it grew. And we're going to talk about sober housing, but we're not going to call it sober housing anymore. We're going to call it recovery housing. Because when you enter into a home where you're going to live and start your recovery network with people, places, things, activities, let's call it what it is. It's recovery housing. Safe housing. You know, unfortunately, so many kids and or people can't go back home for whatever the reason. The level of dysfunction in their house is not conducive.
There's also scientific
to living a life of recovery. You know, I've spoken to Oasis and all treatment providers and said, if someone had said to me when Thomas first went into treatment, we need you up here 3 days a week. We're going to educate you on substance use. We're going to change how life happens at your home. We're going to give the other siblings voices, and everyone's going to heal. Everyone's going to live a life of recovery. With Thomas, I would have been there 5 days a week. But everyone said, just go home and everything will be fine. And I thought everything would be fine, unfortunately, because nobody told me I needed to be educated.
Yeah, and the floor fell out because
the floor fell. So, but in asking that of family members and or whoever you live with, and somebody would have said, I'll be here 5 days a week. you know you have willing participants at home to create a better environment. Or if you hear, it's not my problem, I'm not changing anything, you also know right off the bat what the aftercare plan must be for that individual.
Right, and you use a critical term. You use the word aftercare, and continuum care, aftercare, and there are many facets.
It's called wraparound services now, is what it's actually called.
Exactly. So we are falling short if we just provide a child, a young person, anybody suffering,
Anyone, just a person struggling
with like
substance
say
use.
1 month inpatient. They need outpatient, the continuum of care. They may need medically assisted treatment. They need recovery housing. I mean,
They need a recovery community. When you first come out of treatment, you can't, it's people, places, and things. And that's not me saying that. That's AA that's been around for, 90-something years?
84.
So you need to change the people that you associate with, the places you used to go, because you don't want to be triggered back into what your mind thinks it still needs, right?
Listen, this is
It's a very critical time in your life. So, we have Thrive now. Do people utilize Thrive to its
maximum potential.
No,
Yeah.
they're not.
Yeah.
But these are things that must be taught to people. So when you're so I always use this, and actually Danielle and Lauren will be here next week. They run New Hope Rising. Most of their homes are in the Mastic Beach, Shirley area, because those communities welcome them. They're some of the best neighbors that could be there. The people that live in the house are shoveling people's sidewalks. They're good communities, they're good houses, they're an asset to their communities when a house is run really well.
You just nailed it. When a house is run really well, we have a very unique situation here on Long Island. We have a lot of townships, a lot of municipalities, a prolific state of NIMBYism.
Yeah.
Not in my backyard. In the wealthier areas,
And that goes for sober, recovery housing. That goes for special needs housing. That goes for any kind of housing you want to name. If you don't fit their perfect
paradigm,
right, they don't want you in their neighborhood.
In my own town of Smithtown, they were fighting a house to house young adults over 21 who are on the spectrum. It was
I remember.
knocked down.
Yeah.
It was the plan is gone. So that's a huge challenge for Long Island. Bless those communities for welcoming them, and
Absolutely.
but it's definitely going to be an obstacle for us on Long Island. And there's a lot of bad players out there, but we're talking about the solution today. So we'd be remiss not to talk about the good players.
We have a lot of good players. Well, not
sober
enough
housing.
good players.
Yeah.
I'll be honest. They're the minority of the group, because we still have body brokers that run houses, and all they care about is collecting the rent.
Right.
So,
And we know far too many people. I mean, as I was collecting some due diligence for a piece I'm doing on sober housing, of course, I met multiple people and spoke to multiple people whose loved ones died in sober housing, overdosed in sober housing with a hot shot, brought back to life. I did meet one young lady. I do energy. I volunteer energy work at Thrive, and a young woman there who does energy work also just opened a sober house. So that was promising to see a young woman, and she's taken in some women. We don't have enough sober housing. Recovery housing. We don't have oversight of recovery housing. 10 years back, about 2010, Oasis sent down $26.6 million specifically for Long Island for recovery housing, which they called sober housing at the time. It's kind of be funneled into different areas, which is not illegal. Welfare to work housing. There's a lot of gaps in service, but we've built a bridge,
There is.
and
there's no railings.
And
so
there's
people
no
are
railings
falling
on the
off,
bridge.
To their death.
Yeah.
And a couple of years ago, Arlene Gonzalez was down here, and she is the commissioner of Oasis.
Yes.
And people kept asking her about that. So a state agency that is up in Albany that has regional offices down here, it still is up to each municipality to look out for these housing. That's the first line in the defense there. That is. So if you know that bad things are going on in a sober house, call the police, call your township, keep calling. You got to be the stone in somebody's shoe.
Unfortunately, a lot of the recovery houses are areas where, people are working a lot of jobs. They're not areas of high wealth, most of them.
Most of them aren't. And then actually what happens is the house takes every bit of dollar that resident has, but doesn't feed them. There's no heat. There's the the living conditions are below or subgrade.
Yes, substandard. It's atrocious. It's unethical, but we do have a very unique situation. And listen, New York, there's a lot of smart players in Oasis, in government. We need to come up with a unique solution. Okay, first of all, the cost ratio factor here on Long Island. For every dollar in New York State, it's worth about 60 cents on Long Island.
Yeah.
So we have the cost ratio factor. We have the fact that we have the prolific state of NIMBYism. We have the fact that we have so many townships and municipalities. But here's the deal. In New York State, we have an education department. You know what? There are certain areas that have unique problems. They have their own districts. Like like New York City has its own school districts. You know what? We need our own solution in Nassau and Suffolk to recovery housing. We cannot fit the mold of New York State because we have a very unique situation here. So we need our own. We have to look to our own people from Oasis here on Long Island and work with them. And I know there's a great committee now with the Suffolk legislature. The Dr. Jeff Reynolds sits on it. Lyra's on it.
Though, I'm going to be honest with you. That came at a time when it was election time.
Right.
So that was a committee from 6 years ago that was resurrected. Was it for solutions? No, everybody has the same report, Maureen, from Phil Boyle in 2014. The same reports, it's the same problems.
It's the same.
How many freaking task force that meet 4 times a year do we need? Because you can just say, well, I created a task force, and people hear that and somehow think that was effective. It's not. And I don't really care to hear about it anymore.
Yeah.
We have all the solutions. We know what the solutions are. Get your asses moving and create the environment for the solutions to happen.
Yeah.
That's your job as an elected official.
Right. You work for us. Listen, I have data here. Committees, task force, statistics. You know what? It's time for a solution. In every area. And with recovery housing, it's time for a solution. Make it happen. You work for us. We send billions more to Albany and Nassau and Suffolk than we receive back in services. Billions more. The Long Island Association is our chamber of commerce for the island. And there's some stats. But even those stats are back from 2010. In 2013, actually, the Long Island Index report. Get to work, everybody. But we're the economic engine for the state. We are a huge economic engine. We're like an economic force of nature from a tax-based aspect. So you know what? It's our money. Let's spend it. Let's spend it properly. Let's get more recovery housing. Let's get oversight of recovery houses. Let's get rid of the bad players. Period.
And there was a push a few years ago for the good players to report the bad players. But when you report the bad players, the good players could get a rise. And, so the other part of this is with DSS or with Medicaid, people that are actually supporting our loved ones, right, in recovery housing, you need to raise what you pay folks, because $300 a month isn't taking care of what it did 20 years ago.
Right. I don't think they've upped the ante per person. I came across that data.
They haven't upped the ante.
I came across that data, and that's unacceptable because also of the cost ratio factor. Forget about just
cost of living.
Cost of living increases.
Wouldn't it be nice if you could run your house on $300 a month?
Yeah.
It's impossible.
Yeah, impossible. Food, shelter, heat.
Insurance. Now, insurance with sober homes, up to $15,000 a year in premiums. You have Narcan in there? We don't want that. We're going to charge you, right, 150 times the normal premium for your home.
More gaps in service, more gaps in service, more gaps in service. Once again, the bridge is being built and it's a drop off. There's no railing.
And also just profiting on where you can profit. No, we're not going to let you run the sober house unless you pay us $15,000. That's like holding a gun to somebody's head for ransom.
Oh, profiteers. There are bad players, profiteers out there, and there are some good players out there. You know, like you.
But that's insurance companies.
Oh, that's insurance companies.
Yeah,
absolutely.
you know, for homeowners.
Yeah, absolutely.
So come on, you know, everybody's got to get walking in the same direction all the time.
So what do you see as a solution? You know, we do have some unique problems on Long Island.
We have a lot of unique problems. I think, you know, when someone wants to go and look at a home, right? The neighborhood needs to become familiar with what you do. So I think people need to get educated. All people, that's why I keep doing this show.
Right.
You know, and Senator Flanagan helps me with a grant to do this show. And Senator Flanagan, still a great friend, certainly to me, just simply because he was the first one that got to meet Thomas in the Tupperware container.
Yes.
And you were there that day.
I was there that day when Thomas took a ride with us to Albany. And
I don't know, nobody knew that I even, you know, and I just saw him. And, you know, Senator Flanagan is on his own road to recovery. I'm very proud of him that he shares that, you know, his own struggle.
He's a champion. He's a hero.
He is a champion, but I remember taking Tom out and putting him on and he never said any words to me. He just cried.
He's a human being and a dad.
And he's a human being and a dad. But that was the precipitous for him to go back to the rest of them and say, no. We have to do what's right.
He's been a great friend to the movement.
He has been a great friend to the movement and education and doing everything, you know, and unfortunately, you know, unfortunately, the Republicans are no longer in,
right.
You know, so we hopefully will get the same cooperation.
Yeah. I don't care what they call themselves. You know,
it doesn't really
show
matter.
us the
This
money.
is so
show us the money.
Bipartisan. This has nothing to do with, this is a human issue factor. You know.
And yes, they showed us some money this year, and there's some good things happening.
You know, they showed us the
Gaps
same
in
money.
service. They showed us the same money.
They showed us the same money.
They recycled
making it look like it's new money.
They recycled
it's the
it.
same money.
Yeah.
They didn't fight so hard, you know.
Yeah.
So I'll call it what it is.
Yeah.
Because to sit in these press conferences and no, you didn't.
I'm not drinking the Kool-Aid.
No. So, you know, yes, we need to all work together to move things forward.
Yeah.
We do. A recovery high school was promised in 2015. It hit 2016. It's 2019. We still don't have any viable options for this to be created. So what is the holdup? The money's been there.
Right. There was an article, you and I were both in this article, and you called for, back in 2015, verbatim, you called for a recovery high school.
First off, in my point of view, and as a parent, every high school should be a recovery high school. So that starts with every coach. You know what? And I've said it and I'll keep saying it. The football coach knows who goes out drinking on Saturday nights. When you take your star player and bench them for 3 weeks because of drinking, your team won't drink anymore because of the punishment to fit the crime. So when we stop saying, oh, kids are going to be kids, when we stop closing our eyes, and I'm sorry, but educators are, so I'll say it this way, it's always going to come back to the parents, because when an educator or an administrator calls a parent in and the parent will say, do you have video of my kid putting that paraphernalia in their locker? When you make it so difficult to work together, they're not looking to work against you. They're looking to work collaboratively.
Right.
Because when we all start to remember that our greatest goal for a kid coming out of high school should be that they be happy and healthy and well adjusted. Not that they have a 108 grade point average.
Right.
Not that they've picked one sport and really burnt out from that sport because you need them to get a scholarship. When you let go of all that baloney,
Let them be kids.
let them be kids. Because if you took 5 minutes to talk to any of the kids, they're so overwhelmed and they're not having fun.
Yeah.
You know, so when you say to a kid, this is the best time of your life, why aren't you enjoying it? When you need to have a job, when you need to have community service, when you need to have 108 GPA, when you are done with your list,
Right.
and then tell them why aren't they having fun, they don't have time to even just be and lay on the couch and be mindless.
Linda, you touched on something so huge. Over the last 4 or 5 months, I've come across so many parents and grandparents of tweens, 11, 12, 13-year-olds, 14-year-olds, who are suicidal, who are presenting with mental illness. It used to present late teens, early adolescence. We're seeing it earlier now, neurotoxicity, whatever, stress, societal pressures. An inordinate number of young people
Yeah.
who don't want to live anymore because the pressure on them is
And the bullying.
and the bullying, the meanness, the level of meanness. How do children learn how to be mean? Children are born perfect.
You know what? Kids are going to be mean. They are. It's just, you know.
Mob
but when
mentality.
you used to go home, you were home and you were safe. Things ended at the end of school,
They
right?
follow you home now.
Now they follow you home and they sleep with you because you have your kids attached to social media. You have them attached. When a child on Instagram or Snapchat doesn't get 100 likes in the first 5 minutes, that's all they can think about. What did I do?
Right.
Why aren't people paying attention? Blah, blah, blah. That's what they're focused on.
Right.
When you go out to dinner with your family and you give the 2-year-old in a carriage your phone because you just want to have your time.
Right.
No, you're teaching them how to cope. You give them a device, right?
You're 100%. We're in a collective digital coma. Period. The end. As a society.
It is the best thing that ever happened to us
And the
worst
worst.
thing that ever happened to us. Kids should not be sleeping with their cell phones.
Right.
They're on them all night long. You know, we need to establish rules. You know, our good friend Kim Laube, what's your health policy at home? What's your health policy regarding drugs and alcohol, regarding healthy eating, healthy exercise? What's your healthy policy regarding technology?
Absolutely.
Have a station, charging station. Everybody plugs their phone in. At 8 o'clock, the phone goes away.
Right. That's it. And I'm a big proponent of contracts. You know, make a contract. You know, if you drink, if you do this, okay, if you do this, your phone's getting taken away. If you do this, the car is getting taken away. We're in charge. We pay the rent or the mortgage. We pay for the cell phones. We pay for the cars or whatnot. Parents forget they're in charge.
Parents don't want to deal with the, you know, they don't. Listen, everywhere in the United States, both parents are working.
Yes.
On Long Island, like you said, $1 is worth 60 cents here. Both parents working, right? But also both parents want to be out partying too. The new 40 is the new 20. Guess what? I don't give a shit.
Yeah.
And I'm going to use that word. You had children and you gave up certain rights when you had children.
Absolutely.
Period. I'm not saying that you shouldn't have fun, that you shouldn't do all of that, but how do you show up at home? What's your example to your children?
Absolutely.
And, you know, you want to tell them you don't have to drink or do drugs to have fun. Then show them.
Right.
Show them how to do that.
Right.
But when
And get the booze out of the house. My kids were in middle school and high school. There was no liquor cabinet. You know, get the booze out of the house. You know, lock it
Well,
up.
lock it up.
Put a lock on it. I had a girlfriend that had a key and a lock in the cabinet in the kitchen because she had 3 adolescents at once. Lock it up. Doesn't mean you can't have it.
doesn't mean you can't have it.
Just-
don't ask the questions. You know,
Yeah.
do I put my wine in a red cup so my kids don't know I'm drinking?
They know.
Really?
They know. And, you know, just a pet peeve of mine. Stop going around with the wagon on Halloween with the cocktails. It drives me nuts. I didn't see that when our
fortunately-
kids were little. I didn't see that.
No.
That didn't
and
happen.
Did we even think of that?
No.
I never would
I
have
was
thought of that.
wondering how many cookies I had to make for the kids.
You know, even at Christmas time and in most communities, but in Kings Park, the wonderful fire department comes around. First off, the firemen are drinking too, number one. So you're entertaining everybody on your route. But to come outside and wait on a corner with all my neighbors in a neighborhood,
Right.
and they can't come outside without a cocktail for 15 minutes with their little ones to see Santa,
Yeah.
that says everything
Speaks volumes.
about you.
Speaks volumes.
You know what?
About
Can
our
we
culture.
make
Yeah.
things about just the sheer joy of the holiday?
Right.
How do you show up?
Right.
And I'm not criticizing anybody.
No.
I'm not scolding anybody. There's a time and a place for adult activities. Make it a time and a place for adult activities. Jeff Reynolds was here one time, and this was a great line. Well, my kids are good. They need to learn how to drink before they go away to college. So he actually said to parents, does your 14-year-old daughter need to learn how to have sex in your basement too? Because she's going to do that as an adult also.
Right.
So think about what you're saying before you actually say it. If your kids need to be educated on how to drink properly as an adolescent, well, then they also need to learn how to do all the other activities of an adult. So let them have sex in your basement. Hey, why not?
They're gonna do it
They need
anyway.
to learn it. So,
Right.
yeah, that's going to disturb an awful lot of parents, though, isn't it?
Absolutely.
Let them be disturbed. Think about it.
Right.
You need to think about your answer to that.
Yeah, be disturbed. You know what? This is life and death. This is life and death. And, you know, we have to look at our society in general. So how do we end up with this epidemic? There are a million reasons why. You know, pressure, societal views on alcohol. Oasis allowed us to do a study. There's no more funding for the study. And we did a regional study by high school and parents' favorable attitude towards alcohol. Unfortunately, in Smithtown, we were one of the highest in Suffolk County in Smithtown. For parents, like in other words, not that they were pushing alcohol in their children,
But they didn't think anything bad about it.
Right. They didn't really necessarily have the conversation like, listen, no, this is illegal, you're too young, your brain is growing, this is unacceptable in my household. It was kind of just looking the other way, you know.
And again, the one thing that I still say to parents is, would you let them play Russian roulette with a loaded gun?
Right.
So just because your other two kids the switch didn't get turned on for substance use disorder, why Thomas out of my three kids? Why any one of those kids? So you're playing Russian roulette when you just say, it's okay. He can drink. He doesn't have a problem with that. When do you know if it's a problem?
You don't know.
And once you know that it is a problem, they're afflicted with that disease for the rest of their life.
The rest of their life.
The rest of their life. Kim Lauby does some great education. Substance use disorder can be an adolescent disease. Okay, not in all cases, but if they wait to the ages of 21, 25, less than 2% will have a problem with substance use disorder. 95% as adolescents will have a problem for the rest of their life.
Right. It's a no-brainer.
That's not my thoughts on it.
Yeah.
That's scientific proof.
That's data. And Kim, we have hired Kim Lauby at Kings Park in the Know many times. And that was one of the best presentations ever, honestly, when she presented that data to the parents and the teens. Like, listen, delay onset. Look at the stats. Look at the science. The more you delay the onset, the less chance your child, you know, someone said, hey, listen, you know, if you give your kid a chocolate chip cookie, they have a 95% chance of getting cancer if they have that cookie at 14.
Right.
But if you don't give them that chocolate chip cookie till they're 22, they have a 2% chance of getting cancer.
They're not going to give them the
What
cookie.
parent would give the cookie?
Right. Maureen, we're going to have you back.
Thank
But
you.
the hour went way too fast. Everybody, have a great weekend. Relax and enjoy and teach somebody how to have a great time, alcohol and drug free. How about that? How about we make that a goal every weekend? What's your Friday night activities? We live on the greatest island, right? It's spring here. Go for a walk. Go to the Pine Barrens. Enjoy. Have a great day.